Yeah, my name is Dr. Ayub Manya. I work for the Ministry of Health Kenya as the Director of Health Financing, Digital Health, Policy and Research. So in my docket, I oversee financial management of health systems. I also look at the digital systems, and also these digital systems need to be regulated. So we also organize policies and research. I'm glad to be invited to this meeting because largely it has more to do with the innovations, which actually most of them tend to be digital in nature. And the theme of it being in Africa is that we can actually come up with something that can actually improve the healthcare in the African continent. And Kenya being part of the African continent, we are glad to say that we are always seen as a very superior country in digital health because we've innovated so many things and they are really working. Of course, we are all known for our main M-Pesa entity that everybody copies us, and we've never stopped growing. Thank you.
And are there any key trends in the medical technology?
There are very many. Sorry to cut you short. The medical fraternity never stops growing. From the time we were young in medical school to this age, there are always new innovations. And these innovations are not just for the sake of innovations. They normally come after somebody observes that maybe a doctor is taking too long to do a particular operation, maybe something would be better. Then somebody comes up with a way of doing it much better. So every day it is growing. When I was a young doctor, the best surgeon used to open the whole abdomen. Actually, they used to say big operations for big doctors. At the moment now, they don't even open. They're actually using ways of just a probe, and they're able to use a camera and see everything. So every day things are changing, and that is good for us. What is important is to make sure that our people are aware that with the changing things, you need also to change. You also need to accept that you can actually talk to a doctor who is in another country through maybe telemedicine instead of that doctor touching you. And that creates a lot of faith in the new things that are coming, and that faith only comes through maybe training and change of the way we do things. And also to make sure that these new things are accepted, we also need to nurture them in terms of buying the technologies, training the people, and also letting the government take up. Because the biggest worry is that people don't take up, and then there is no sustainability, and a good tool is left out.
And how is AI transforming the medical technology?
Yeah, AI is really new, and it's coming up very quickly. One of the easiest way now, the AI, things like even speeches are now being done by that. Some of the notes, maybe the doctors are being done very quickly, then medical notes, and even just analysis of data is already being happening, and therefore it's very easy to inform policy. So AI is coming, and I'm sure you are all going to see new ways of operations assisted by AI. And so I think the future is quite interesting, and we are all happy. Some of you look young. You're going to have a very interesting life ahead with the innovations. Thank you.
Perhaps, Dr. maybe you can tell us the status of digital health in the country right now, and maybe the future. How does the future look like?
Right now, what is so urgent is that the government has decided to adopt e-government. I think you know what I mean by e-government. Most of things are now being done not on paper. You can apply your passport without writing on paper. You just do e. You can pay through the M-Pesa. And so everything is now actually being used by e. On top of that, in the medical world, we are also digitizing health records so that when you go to a hospital, you don't need to write things on paper, just your names and everything. If you put your name on the computer, it brings up all your other names, which are normally kept by the national systems. So we have taken e-health very high, and we have adopted, and we believe if you take this, it will actually improve the efficiency. It can make you see a doctor very quickly. Your data that you are seeing in another place will be brought, and then you can actually you can improve your healthcare. But of course, it also has some negatives. first, we really need to take care of the issues of privacy and cyber security. Some of you have enemies. Somebody can easily steal your information and take it to somewhere. And then it can easily, I think in the old days it was very hard to spread a rumor. But now with the digitization, one thing can spread very quickly. So we need to be careful about privacy, security, cyber security, and also we also need to be aware that people can steal this data and actually sell it. So we have to be careful about what we are doing. And also instead of it actually it being improving efficiency, if we get some very clever young boys and girls, they are able actually to use it to the negative and even get things stolen, get money stolen. I hear there's a story of where a young person used to steal 1 cent from your bank without you knowing, and he became a millionaire. So all these are loopholes that we need to take care of as we move forward to digitization. It's not as easy as it is, but by and large, it is something worth adopting in Kenya.
Apart from the e-record, maybe you can state other technologies that the Ministry of Health is working on or already going to have.
We have quite a lot, especially in the medical field. The X-rays, you know about X-rays. They are so advanced from the one I knew when I was young. We have all these dialysis machines that are coming up. We have even Kenyatta University have one called a cyber knife, something that I think all are coming very quickly to support us. So in the medical technologies world, there's a lot that is coming. The laboratories and so many things, and some of these laboratories are even linked. So immediately the specimen is done, it moves to the doctor without necessarily you carrying a paper. So there's quite a lot in the medical technologies world rather than just the data world.
In this conference, what have you discussed that is going to help Kenya as a country?
Now this conference is more than Kenya alone. So we have innovators. You will find out what they are doing in South Africa, and we'll find out what is happening elsewhere. And then there's this concept I was telling them about copy-paste. We can also copy the other side and bring it in Kenya. But I also warned that copy-paste sometimes doesn't fit in the space you are pasting. So we must also be careful about our space to be able to modify it well to receive some of these technologies that are in another country. So we don't just blindly copy what is in America and bring it here. So we as a team in Kenya must have a group that actually sits and looks at what technology is being brought and whether it fits in our space or not. So this is a marketplace that we see what is happening and what can be helped and what can be copied. And then if it's good, then being a government official, I'll be the agent to say, yes, this can be useful, and now can we have a technical working team to evaluate further. Some of the issues we have, and I think I need to raise it very clearly, is that we tend to have ethical issues. When you bring a new thing, you don't know how it might harm. So when you're doing ethical reviews, there are even no people in this country who might understand the ethics because you don't know what it is, what it may have. So we have shortfalls of how to be able to analyze a new technology ethically, whether it is going to help us, whether it will be bad. And just for the record, or in a light way, when we got the COVID vaccine, we were told we will be dead in the next 2 years. Luckily, I'm still alive. But just because nobody knew the impact beyond today. And these are the areas sometimes you have to trust. Is it in God? Because we don't know the new thing that has come. And so we have to come as a government body to be able to put policies and regulations that can guide some of these ethical reviews, some of these areas, so that we also observe the impact before it becomes too long. Maybe some of us will grow horns now that we got the vaccine. Nobody is there to watch. So that means we need also research. And that's why I'm also in charge of research, to be able to monitor the new things that are coming up, what impact they can have on the population, and what fears and some of the ways that we can actually alleviate some of these fears. So those are just largely the areas to look at. Bring in new things, but also be watchful of what it might do to the whole nation and also humankind. You never know. They have just been talking about the setup, like financial setup. if we do something, who is going to sponsor the innovations? And when the innovations are done, who is going to sponsor the implementation? So as a country, we also need to be careful about supporting these innovative hubs. And that when we support them, we must also be willing to support the implementation of the new product. So we are at the level of looking at the financial areas and how can we innovate, who supports. We tend to be supported by external bodies, and most of them support the innovations. But very few people want to innovate to support the implementation. And that now comes back to Kenya. And me, when the people ask me in the ministry about innovation, that we are bringing this, I gladly say, yeah, it's good, but who is going to support the implementation? So, ya kawaida serikali ya Kenya huwa inatengeneza bajeti, na sasa hata wameanza kutengeneza bajeti, na hiyo pesa inaenda kwa kama KEMRI ya pesa ya kufanya research. So hiyo iko kwa mpangilio ya Kenya iko. Hatuachi mambo ya research, na and you are aware kuna a very big organization inaitwa KEMRI. Yeah.
Thank you so much.
Thank you.
Okay.
Wilfred Njagi, I'm the co-founder and CEO at Vilgro Africa. We are a healthcare business incubator and also an investor. By incubation means that we work with very, very early stage innovations in healthcare. We give them technical assistance, mentorship, coaching, advice, and a little bit of funding so that they can start their business. Why this conference? So this is the third Transforming Africa Medtech conference. And if you all remember what happened during COVID, we were on the last, when it came to receiving PPEs, when it came to receiving phototherapy machine, when it came to receiving the equipments and the PPEs, and when it came to receiving other devices that were needed during COVID. So we had to be on the waiting list, and that meant that we needed to innovate on our own, right? Because, for example, when we wanted ventilation machines, you remember that time, we didn't have capacity to make ventilation machines, and we had to wait until the rest of the world was fully supplied and then for us to get. Same with vaccines, yeah? Others had to get vaccines first, and then we were at the end of the waiting list. So even before that, Vilgro was supporting local medtech innovations and local healthcare innovations. So COVID just emphasized the need for homegrown, locally made solutions. The other thing is, when you make it locally, it's easy to service it. You go to our hospitals, there's a junkyard of equipments that have failed. They were bought from China or elsewhere, and when they break down, servicing them and bringing them up to speed is very hard, because you can't fly in the engineers from China to come and service it, and sometimes they don't have what we call SLAs, service level agreements, that allow them to maintain. So that's a huge gap when it comes to importing medical devices. But if you made it locally, then you have local engineers who can be able to service it and make sure that it's up and running. So that's the reason why we believe in homegrown local solutions. Now, this conference is an African conference. It's a conference to spur or to bring anyone else who is thinking about innovating locally for medical devices across the continent. This is a home. We're creating a home or an umbrella where they can come, share notes, collaborate, exchange notes, meet with other government players, meet with private sector players, meet with other fellow innovators. So it becomes one point where meeting point for all the different players in the medtech industry. So that's why we are creating it. We hope to make it even bigger, and hopefully we'll start rotating. It's been here in Kenya for the last 3 years. Hopefully we can start taking it to other regions, West Africa, North Africa, South Africa, so that we spur this movement. Remember also what is happening in the funding scene. A lot of donor funding is freezing, starting with USAID and others. That means that things are getting tighter, and you'll need locally made, affordable solutions, both in medtech, that is hardware, and also health tech, the digital solutions. So that's the reason why. And the other thing is that there's a return on investment to be made. First of all, in terms of impact, the number of lives we can save with the locally made medical devices. There's so many hospitals that don't have equipment. You just go there, you want a scan to be made or a diagnostic service to be done, and they don't have the equipment, so they basically just assess you clinically, and then they give you a diagnosis which is not evidence-based. It's not been tested or diagnosed properly, and then that leads to other complications, because then you end up over-treating somebody for something that they didn't have, which leads to more complications, which leads to even more healthcare spending. So trying to reduce that is by coming up with solutions that can help us, local solutions that can help address some of those challenges. The other return on investment is we see that for every dollar of funding invested in healthcare, you unlock four loan dollars, or $4 of return investment. Remember, a healthy being can go to work, can go to school, can do other things economically, right? But if someone was ill, then you're losing out on so many other things, right? So investing in healthcare is the right thing to do, right? If you care about the economy, the first thing to invest in is healthcare. And we are leading that as View Grow Africa. We've been doing this for the last 10 years. So some of the challenges that came from first and second conference, one was the issue of regulatory, that when you innovate a medical device, the regulatory approval process is so cumbersome. It's a lengthy process. Not only that, is that you also have to repeat it in every new market. So you get approvals for Kenya. If you go to a neighboring Uganda, you start again from scratch. And it's very cumbersome if you have to do that across 54 countries. So one of the things that came out, and we are continuing to discuss, is how do we harmonize, have a single market approval that once it's approved in Kenya, you can sell in 54 countries. So that's one of the things we are addressing. The other thing we are looking at is the issue of funding, and we're asking ourselves, can we also look at government, one as a purchaser or someone who uptakes or buys these innovations and solutions, but also they can also invest through the innovation research grants, right? We see, like here in Kenya, you have the National Research Fund. Can some of that money go into healthcare? So government now can become a player, not just from regulatory, but also from investment side, and also from the market side, by becoming by uptaking some of these solutions. Yeah.
The status of innovation. How does the Kenyan innovation
Yeah. So Kenya, for the population we are at 50 million, we are doing quite well, because we end up being top 4 innovation hotspots in Africa, right? We are in the same league with Nigeria, Egypt, South Africa, right? And for our population, you can see we are doing quite well. For our population, and also for economic size of our economy, we feel like contending for the top 4 position, we are doing quite well. Of course, fintech is leading the way, has always led the way since M-Pesa and other mobile-based payment platforms. That has always been the #1. But we're seeing health tech and Medtech also coming up, right? Today we are looking at a deal that just happened in South Africa, a $100 million deal between a local hearing aid device company in South Africa that's just merged with a US-based company, which shows you that even global players are seeing that innovations in Africa have a huge potential. Because when you innovate for Africa, you're innovating for the low resource setting. Remember, here we don't have power, we don't have this, we don't have that. So if you innovate it for Africa, it can work elsewhere in the world. It's optimized for low resource settings. That means it can work anywhere else in the world. In terms of cost, you're also innovating for something that is affordable. So those solutions can then scale across Asia, Europe, other parts of the world. So when you look at the landscape, I think Kenya is doing quite well on the map. Even when you look at this conference, you can count how many Kenya-based healthcare solutions are here. So very proud as a Kenyan that we are leading the way. But that's not enough. We also want to other countries to. Kenya cannot innovate for everybody. So how do we spur innovation in other markets like Benin, Guinea-Bissau, Senegal, all those places? So this conference is to spur that kind of spark, so that other countries can also follow suit. Because the future for Africa is local, homegrown solutions. With the way things are going, we can't afford to keep importing. So this is the way to go.
The question that always comes up is who's going to fund these innovations? They are sufficient funding.
Yeah. So funding is always a challenge. It's an interesting challenge. When we began funding healthcare in Africa 10 years ago, people thought we had lost our minds, because they thought, who else is going to fund healthcare? You're going to be alone in that space. But we've seen other players come in. Actually, To date, we've invested $4 million of seed funding across about 20 to 50 companies that have gotten seed funding. Those companies have gone on to raise $40 million of follow-on funding. So they've unlocked 10 times. So we've proven ourselves right that if you invest in healthcare, others will come. Because once you de-risk a company, it starts to make economic sense. So it becomes an economic decision for an investor. This is a place where I put money, I'll get a return on investment. So we've proven that using our model and the funding that we put in our companies. We've seen 10 times more funding unlocked by other follow-on investors. So clearly there's a market there. Yeah.
Maybe another question. What are you doing to ensure that these innovations are maybe
infrastructure insufficiency, we are able to align.
So one is to
go ahead and merge.
To be close to where the action is happening, right? So innovation, you can't innovate in a boardroom. You have to be in the hospital setup. You have to go and see what is happening in the hospital wards. And that's the only way you are able to innovate. So we put our ears on the ground. We encourage our innovators also to be on the ground. Go and speak to your end users. Speak to the nurses. The nurses will tell you where the challenge is. Speak to the patients. And then you're able to build something that works for them. If you don't do that, then it's recipe for disaster. You can't just build in isolation. You have to build together or co-create the solution together with the users.
Those particular gaps, because we've seen that in a lot of companies.
Maybe you can explain what do we expect at the end of it in terms of the
In terms of?
the medicine.
So at the end, two things we try to do. Vigo Africa exists to solve Africa's toughest healthcare challenges. So when we invest in the long run, we expect increased access to healthcare, which is affordable and high quality. Those are the only three metrics we look at. We have to increase the access, but it has to be affordable, and it also has to create impact. Yeah, it has to be very high quality. Being affordable doesn't mean you compromise on the quality. So high quality, but affordable. Yeah, I feel like with SHA, government is a payer. As we are innovating, we expect the innovators will also be able to get a market for their solutions. We look at SHA as a public payer. It's not the only payer, right? Private sector also pays for innovation. But we are hoping, and progress is being made in terms of making SHA work for everybody across the different social segments. So we hope they keep doing that. When we talk to our innovators now, they are saying they are now able to get paid. Nowadays, they are able to get paid. They can provide a solution to government, and they are able to get paid. So that's a very good news. We need to do more of that. So that then, because if you're innovating, you're providing a solution and you're not getting paid, then you end up shutting down, right? So I think SHA needs to keep doing what they're doing, and also make sure that the payments are also coming in good time, right? Because then when SHA is able to reimburse the hospitals, then the hospitals can be able to pay the innovators who have provided them with digital solutions, with Medtech solutions, and other kind of solutions. Yeah.
By looking at the issues as an expert, what do you think could be the reason as to why there are these issues with SHA?
I'm not able to comment because I don't work within the SHA system, but I feel like they've taken the right step where they're saying universal health coverage. Because if you're leaving some people behind, then the healthcare system collapses. Yeah, I don't know how many of us have been put in WhatsApp groups to fundraise. Yeah, someone is sick, you have to fundraise. But now what SHA is trying to do is covering everybody, right? Not just those who have, but also those who don't have. And being able to, is all inclusive. And we need that. When you talk of universal health coverage, you have to look at what are the barriers to achieving universal health coverage. Some of them are social determinants, including level of education, economic status, and things like that. And SHA is trying to level that ground by making it an even playground. Yeah.
My name is Jeremiah Goodluck, the founder and CEO of Gonep Pharmaceutical. Gonep Pharmaceutical is a medtech company, a startup. We are here in Kenya. We are developing a point-of-care medical device called Clinic at Hand that is geared towards bringing healthcare at your doorstep.
So, what's the whole mechanism around it?
So, Clinic at Hand, that is the name of the device. The concept is we are empowering practitioners to be able to provide outreach kind of treatment that maybe you are in your house and you do not want to go to hospital, but you still need a doctor to see you. So that's what we are doing. We are seeing right now the trends in healthcare also are going that just as technologies develop, we are also seeing that people want a lot of conveniency, but now, yes, facilities wants to provide that, but maybe there is a lack of technology to do that. So that's where we are coming in, as building a homegrown solution made by Kenyans here in Kenya to be able to solve our challenges, just being helping each and every person to have access to quality healthcare.
So do you visit the patients at their homes, or how do you communicate to the patients?
At the moment, we've finished product development. That is the final. We have a final product that is just fresh from our labs, and we are now how it works. That you request a practitioner to come to you. So we also we liaise with telehealth providers. Of course, you know telehealth providers, when you are reaching out to them, maybe virtually, there is need for quality diagnostic. So that's where we come in. That you've seen a doctor, but you need to confirm what is it that that is ailing you. So that's what this device does at your convenience. For now, our technology is able to conduct a liver function test, that is knowing how your liver is, a kidney functionality. We're also looking at, remember, many people who have developed kidney failure is because they've been having this problem for a very long time, but they never accessed this diagnostic at a very early stage. Because also these diagnostic are at a very sophisticated side of the healthcare system, that you need to get them at a bit higher level in the hospital. So here, and remember, most of our people in Kenya, they rely on more primary healthcare and also these small clinics for their initial healthcare. So we are looking at, when we empower these small clinics, empowering these people who are very close to the people, then we are going to be able to achieve that.
Maybe how is the reception of your innovation? How many people have been able to?
So currently we are having 5 clinics that we are working very closely with them and validating and also testing our machine, and also giving us feedback in terms of what they expect and how it is serving them. And the reception has also so far been good, and even we are having more healthcare providers willing to even do mass ordering. So the reception has been so far good with this device. Yes. Okay. Now, for what we are doing differently, the first thing, remember, we are a technology company. We build technology. And this the community health workers need technology. Remember, what they were just given was a bag and maybe a few things with them. But now what we are saying, ours is like just a briefcase. It has an inbuilt computer in there. It's able to take patient record, and it's even able to relay this information to the parent hospital. So what we are saying is that we are not competing with them, but we are just giving them a solution that will even make their work very easy. Yes. On the cost, of course, having it developed here in Kenya, of course, you understand we are having models that are also convenient with the users. Like, we give you the device based on your ability to pay, or we are looking at if you can't pay, can we give you the device, then we share on the revenue. So we have a very flexible kind of costing that it's not standardized, but it's based on the user and the provider. Yes. Okay, thank you.
Good afternoon. My name is Joy Okoy, and I'm the team lead of the Health Guardian. We are working together to help reduce the death of mother and child, because this is one of the major problems affecting Nigerians, and not just Nigerians, Africans, not just Africans, globally. We made our research and saw that over 150 million babies were born preterm in the last decade. This is according to UNICEF in 2023. Also, according to WHO, we saw that of every 10 babies born, just one of them is preterm, and every 40 seconds, one of those babies die. It is therefore evident that we need to make a solution that can be able to help mother and child. And that is why I am here today to talk about what our company is doing to help reduce the death of mother and child. Thank you. Okay, so after researching and seeing that there was a problem, we thought of what exactly can we do. We knew that we needed a solution that is cost effective, that is affordable, that is reusable, and very portable, while being very easy to use. And that was why we sat down together, got calibrated sensors, put them together, put them in an embedded and small enclosure, just to make sure that when mothers use this device, they are able to see that there is a problem and seek medical care.
So do you train these mothers to use the device, or how do they get to use it?
So we are going to be working very closely with the hospitals, with the obstetrician and gynecologists in particular. This is because they are the closest to helping us get to the pregnant women. And it is very easy. They don't need medical supervision. They don't need to be in the hospital. It can be used at home and at their comfort. Thank you.
Oh, okay. Okay, good morning everyone. My name is Alice. I'm a medical doctor and the founder of Aurora Health Systems. We're a medical technology company innovating a solution in cardiology. So just for context, cardiovascular disease is the leading cause of death in the world. So in the next 5 years, cardiac disease will take over from infectious diseases as the leading cause of death in Africa, according to WHO. Yeah, so in response to this, we have developed a wireless electrocardiogram monitor to monitor heart patients real time. And this allows a lot of patients to be monitored remotely by their doctors, even when they're in a rural facility. Yes. So one of the biggest challenges is that we have a low number of cardiologists in Kenya. So Kenya right now has at any one time 30 to 40 actively practicing cardiologists. And if you compare this with Europe, Europe has 800 cardiologists per country on average. So the lack of specialists and the lack of specific and sensitive diagnostic tools for cardiology is one of the biggest challenges that we're solving. Yes.
So is the machine already in use? How many countries are so far using it?
Yeah, so currently we've done some pilot testing, we've done clinical testing, we've also done a research paper with the Kenya Cardiac Society. We have also have the support of Dr. Munsingabala, who is a cardiologist at Hampshire Hospital. We are currently partnered with one of the largest technology companies in America, known as Qualcomm, who is supporting us to integrate artificial intelligence into our device and launch in the next 12 months across Kenya. Yes.
So it has not yet been deployed.
Yes, because of there's a lot of challenges around regulation, as you're aware. So there's currently not a solid there is no regulatory clear regulatory support for young innovators. So a lot of times events like this are very important for us to come and engage with different stakeholders and to understand how we can better pilot our devices and go into market. Yes.
You can explain how that machine will work and how to be able to prevent the death.
Yeah, so cardiac disease is an uncommunicable disease, and it's a very time-sensitive disease. And because it is time-sensitive, you have to have early detection. So that is what we are doing at Aurora. We have early detection of conditions such as atrial fibrillation. So we capture this before they turn into myocardial infarction, which is what is known as a heart attack. So we do early detection of this, and again, like I said, there are no specific and sensitive diagnostic tools for that have, especially in rural facilities outside of Nairobi. So that is our main target market. Yes.
Alice?
My name is Alice Mohoho. Yes.
One of the things we are realizing is that yes, innovations will be on the table.
Yes.
But how do you market them? Are there funders? Are there buyers for these innovations?
Yes. Okay.
Will a patient be buying it, or will it be even voluntary just to help the community?
Okay. So your first question is, are there any buyers? you're asking. So definitely, when you're talking about anything in medicine, there will always be, it is very important, of course, to have diagnostic equipment. So the buyers are there. The issue is now, who is going to pay? That's one of the biggest problems that you have to ask yourself. And with the low insurance penetration, right now in Kenya, you know that insurance is in Europe, and I trained in Europe, and I remember medical devices were covered by insurance companies there, which allows medical devices to scale. But here in Kenya, a lot of medical devices are not covered by insurance, so it becomes very difficult to have somebody to pay this. So what you have to do is just innovate your business model and get do private-public partnerships, maybe with the government, and also work with maybe private insurance companies to pay you. Yes.
Thank you. Asante.
Thank you so
much.